You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, how small improvements made to your smile can make a big difference in not only how you feel about yourself, but how people perceive you. It's a smile makeover show today. And according to my first guest, he says just small improvements can change everything. With us, we have Dr. Webb. Dr. Webb, welcome to the program.
Thank you, Randy.
Now, before we get into today's topic, for people that don't know your practice, I guess you've been practicing about 10 years.
That's
Is
right.
that right?
That's right.
Who's a typical patient and what are the different services you offer?
I practice in a family practice with my dad and my uncle, and we see families that they've seen for several years. And my passion, my focus in this practice has been to do cosmetic dentistry. It's what I've realized is what I'm the best at and what I enjoy the most at. Many people know our practice. My father and my uncle have been practicing there for just under 40 years, and they have a great reputation.
So who's coming in for cosmetic? And define it. Like, what are the categories of cosmetic dentistry?
Cosmetic dentistry, it's everywhere. It's everything we do. There's the mother who brings in her little child devastated because they fell at school and chipped their front tooth. It's the mom and daughter coming in, getting ready for the wedding. It's the young man who is trying so hard to get his promotion at work, trying to get that next job, and he wants to look the part and be confident. We had a young man come in, and you don't see this very often, but
oh my goodness, let's take a look at this.
He had kind of lost hope in his teeth and just expected to lose them all.
So that has to be unusual, though, for it to be this bad.
It's unusual for you because people are always hiding it. They're going their whole lives trying to hide what their teeth look like. And when I saw him, I explained to him that we could fix it so easily in just a couple of short appointments. And we were able to do that for him.
Wow.
And just with some filling material, we were able to make his teeth look great. And he's always smiling now, and he's so confident. And he comes in regularly for his cleanings, and he knows he's going to save his teeth, and he's very happy about it. Yeah, when I showed him the mirror, he just couldn't believe how much better he felt about himself, and he started coming for his cleanings regularly, and he was just very happy about it. In
your practice, because you've tried to restrict your practice to just the cosmetic part of it, is that right?
That's my focus.
You do a lot of veneers in the practice. How does somebody know what their teeth are going to look like ahead of time? Ahead of time? Yeah.
Well, we have a smile design process that we go through. We take some photographs and we diagram and plan out on the photograph what we want them to look like. And then they are waxed onto a stone model, and then we can actually try those in the patient's mouth so that they can see what they look like. I have some photos that I can show you.
Okay, let's take a look. Let's take a look at some of them.
So this patient, we were able to make a computer image of, based off of the diagramming, where we wanted the teeth to be, where it would fit his face the best.
So that's just a computer image
of
what his veneers are going to look like.
But it's not just someone else's smile that's transferred to his. It's how we would design his smile to fit his mouth and his lips.
Okay.
And then we're able to actually try that in their mouth without them committing to doing it. This is where we just have it in half of his mouth, so you can see where we add the material and the length. He didn't like how his teeth were shorter and that they were had some spacing in between them.
Okay.
So we were able to try that in to see what change it would make. And you can see, look at his after picture there.
So these are not, they're just something you're just temporarily putting on just to let them know what it's going to look like.
Yeah, it just lets him try it out to see what it feels like, what it looks like, without having to commit to it yet, just so you can see the change. And he loved it. He loved how it brightened up his face, and you can see in the before and afters how much more he's smiling and how much more he likes that.
What do they say? I mean, when you're just putting on is this on just on the exam, consultation?
Just on the consultation. You don't even need to get numb. You just
and what is it? It's just material that goes on the teeth?
We're able to use a mold that puts the shapes right over the tops of his original teeth that just temporarily stays there.
So he looks great. I mean, in the before and the after, he almost looks more mature or more sophisticated.
Yeah, he looks a lot more confident is what I think.
Now, you're a dentist, so you probably feel like the smile is one of the most important things. How important is the smile in your opinion?
One of the best examples that I've ever heard of is when you get something stuck in your teeth, how it makes you feel. You are constantly covering your mouth. You're constantly wanting to go check in the mirror. Your front teeth, your smile is so important. When they do a survey about what they find attractive, what people find attractive in certain people, always at the top is a smile. One thing that I've seen with smiles is that it connects people. What do you mean? It's the feature of a relationship that's just connecting to people. It's how we engage with others when we talk, when we listen, when we smile.
Can you tell, by the way, I mean, you're walking around Utah, can you tell when people are hiding their smile? Can you see it?
Yeah, and I can especially tell when they get their photographs taken, and when they're talking about the photographs, they're always very aware of what they don't like about their smile in their photographs.
Well, you see it on Facebook where certain people, now that I've talked to dentists over the years, I can spot it, people in their selfies, or they're smiling with their mouth closed.
Yeah.
Right?
Yeah.
And I think you told me on the phone that when they come in for the consult, sometimes it's tough for you to get them to smile.
Yeah, and is
that right?
It's so sad to see people covering their mouth with their hand while they're talking. And it's just because they're aware that their teeth don't look good. They're aware that it's a distraction to who they are, and they don't like it.
So you brought some more photos. What else are we looking at?
Yeah, here's a man who came in. He had 2 crowns on his 2 front teeth, and the rest of his teeth were really worn out, discolored, chipped, and it was bothering him. He didn't like how it made him feel, so he asked what we could do, and I was very happy about telling him how this was the perfect case because we were able to just add back the tooth structure there. We were able to replace those 2 front crowns with something that was a more natural looking porcelain. And then you can just see how it
Wow, very nice.
Changed dramatically how he looked and felt. So with him, we designed off of his photograph, off of his face, what would look the best, and we were able to try that in his mouth, and he was able to see, and he loved it. So
you kind of put some temporary stuff.
Yeah.
And they look. What do they say? Do they say, "I want that"?
Yeah, immediately. That's
okay.
The most rewarding moment, because that's the moment where they see for the first time what is about to happen to their life, and it's great.
All right. So with him, what'd you do?
So we removed those 2 front crowns. We replaced it with a porcelain that was much more natural, lifelike, that had the ridges and the contours to make it look true. And then we added the crowns on the back to broaden his smile, to fill in where the tooth structure used to be. And we got a great result.
Now those look like real teeth. And we've talked on the phone, and I said that I feel like I could spot veneers walking down the street, 20 yards away, right? We've all seen these shows where the big, bulky, fake-looking veneers. And my question to you is that in the hands of the dentist, or do people want that big look, the big teeth look?
No, it's definitely in the hands of the dentist. It's definitely in how the case is designed and how it's made to look very good, but also lifelike and natural and real.
Now, this looks pretty natural, and I'm not trying to side with you on this, but it does. And we've talked on the phone. I feel like I could watch or see veneers walking down the street. That means they seem to be big and bulky, and we've seen like these housewife shows with these big veneers.
Yeah.
Now, is that what people want, or is that the dentist, you think, making a mistake?
No, it totally has to do with the dentist. It totally has to do with how it's designed, how the porcelain is created, and it makes all the difference in the world versus something that looks like chiclets to something that looks natural and beautiful and
so how does somebody,
attractive.
Because not all dentists, look, it's like you're in a family practice, but not all dentists have this commitment to cosmetics, right?
Yeah, every dentist has their own different interests.
So how do you know? How do you find out if your dentist is a cosmetic dentist or is taking?
Yeah, like I always say, the very best guide is through the American Academy of Cosmetic Dentistry. They have this credential that is not something that dentists can just pay money to get. It's not just an advertising scheme. It is truly the only way that you can know that somebody is going to give you predictable, good results. And it's very well respected among dentists.
So you have to submit your work?
Yes, you have to submit.
So like a board?
There's a board of expert cosmetic dentists around the country who blow up the dentistry on big screens, and they have like 75 different criteria they go through and grade to make sure that it's going to look the best that it can and that it's going to last. And I became very excited about this when I came across this process, and have really just been putting all my focus and efforts on helping dentists in Utah to reach this credential.
You've created that group of people. I mean, because you really want people to seek somebody that's had the training.
It makes me so sad when people get excited about doing something with their smile, go and have it done with their dentist, and then they regret it because it doesn't look real, it doesn't look natural, or that it keeps falling off, or it hurts.
So is it more art than science, or a combination of both? And do you really have to have an eye for this?
Absolutely, it's definitely art. And you need to be able to look at the kind of dentistry that's being done by those dentists and realize that that's what you can expect, something similar to that.
So when you see a guy like this, right, do you, on the consult, do you see the end result, I guess is what I'm trying to say?
Yes, and I love showing patients what that end result will look like through the smile simulation and through putting it in their mouth for them to look at temporarily.
Okay, good. So you have some more photos. What else are we looking at?
Yeah, this is a photo of a woman who, she was unhappy with the way her teeth turned out. She always liked her smile, she always liked her teeth, but something happened that after time, she just began to not like them and didn't fit who she was. So she brought in a picture of how she used to look, and she asked us if we could make her smile match what she used to look like.
So she brought a photo when she was younger.
Yeah, and we designed her teeth to fit who she'd always been. And when we presented that to her and showed her through the mock-up what it would look like, she was very happy about that. And so we scheduled the appointment, and a few weeks later, she was back to feeling like she always did about how she liked her smile. Look at the before and after on this woman. Her teeth before, she had an okay smile, but it showed that it was worn. Inevitably, we're all gonna, if we live long enough, need to do something with our teeth because they just wear out over time. And if you look in the after picture, you can see how we rounded the edges to follow her lower lip line, and we gave them some brightness, but we didn't make them look too bright, too white. She didn't want that. She didn't want to have a Hollywood smile. She wanted to have the smile that she had always had when she was younger. And you can look at her eyes and look how much younger she does look.
I mean, on the before and after, she does look younger.
Yeah.
On the after. So the patients that are coming in for veneers or to upgrade their smile, what are the age ranges?
Age ranges from people who are in their 50s, 60s that want to look like they're in their 30s again, people who are in their 30s that haven't liked something when they were a kid to wanting to make it look better. It really is a wide range of different
What are the
ages.
oldest patients that are getting veneers?
I had a woman who was in her 80s that we did some short-term braces with, and then we put some veneers on her, and she's been very happy with how it's made her look younger.
In your opinion, when should somebody get a smile makeover?
If somebody doesn't like their smile, if something about it, they should do something about it. It's so transformative, so empowering that there's no reason why you shouldn't get it fixed. People just don't realize how easy it is, how it can be done so quickly, and then it just changes from that point on how you feel about yourself, how you feel about when you look at people and talk with people.
So do people tend to do this, take care of their teeth because of a special occasion?
Yeah, a lot of times people will come in because they have a wedding coming up or an important job interview. A lot of people will have just different events, and they know they have a lot of pictures coming up, and they've noticed in their pictures that they don't like something about it, so they want to see what's possible.
What do they say? On the consult, what's their chief complaint? Or do they say, doctor, you tell me?
Honestly, a lot of people don't know what can be done and how things can be fixed. So a lot of times I'm giving possibilities and suggestions, and then we do some sort of trial in the mouth so they could see what the change would look like. And like this woman who came in, she had some cavities when she was younger and on her front teeth, and they were discolored and chipping, and they were just becoming a nuisance to her. And I suggested that we look at what it would do if we replace those with some veneers to strengthen the teeth and brighten her smile. So we tried in her mouth, and she loved it, and we changed those 6 front teeth very conservatively and in a way that strengthened so that they wouldn't be chipping and breaking. And you can just see even from this side smile picture how much it made for a more pleasing look. Yeah, if you look at the edges of her teeth before, they were really jaggedy. And when we just smoothed that contour with the porcelain veneers, it just made it look so much more feminine, so much more attractive.
Yeah, it's a pretty smile.
Yeah. And then I have another picture of a young man who came in, and he was thinking about getting braces, and I talked to his mother about how if we just improved the shape with some bonding, if we added some composite material to those teeth, that it would make a big difference. We tried that, and his mom said that
it's very nice.
His grades improved, that he started carrying himself with more confidence. He wanted to get a haircut. It made a big change in his life. It was a huge impact.
So there was a little gap on the before. I mean, a lot of people are bothered by these gaps.
Yeah, yeah.
Because some people love them, some people don't like them.
Yeah, so a lot of times the solution is to close those spaces, but if the shapes of the teeth aren't the right size or the right position, then that's where veneers or bonding comes into play.
Now, do you, as a dentist, do you secretly think that this guy will end up more successful because of his smile?
Absolutely. I mean,
what are your thoughts
if
on
his
that?
mom said that it actually changed how he felt about himself, that he started getting better grades, you know that education in school is going to make a huge difference in his career. It truly did change his life. He didn't like his smile before, and when we got it to the point where he loved it, his confidence changed dramatically, and that's going to make a huge difference in his life.
Okay, good.
With his friends and the choices he makes and the school and career. It's a big thing. This is a photo of another young man who felt like the shape of his teeth, if you look at those shapes, he didn't feel like they fit his personality. You may have heard people talk about how teeth have personality.
I have not heard that before.
It's true. It can affect how your personality is portrayed.
Really? Like what? What do you mean by that?
Well, if you look at his before pictures, the edges of those teeth and the roundness makes them look more childlike.
Okay.
And
all right.
You could even say a little more feminine. And when we straightened those out and made them more square, then it just fit his personality so much better.
I got it. Okay. So it is a little bit more sophisticated look.
More mature, more dominant.
He looks like an actor now.
Yeah.
So do you get proud of your work, by the way? This seems like an obvious question, but when you show me these, because it's like you're showing me baby photos here, you like it.
I do. I love making these changes. When you're able to just add material, in 1 hour we were able to change this kid's whole feeling about himself. Because it comes out in every interaction he has with other people, with his friends.
So to do this at the level you're doing it, does it cost more to go to somebody that's been, I guess, certified by this American Academy of Cosmetic Dentistry?
No, it doesn't cost more. It just looks better and lasts longer, is how I would sum it up.
Why do you say it lasts longer, the way you do it?
It lasts longer because we're not cutting down the teeth to little stubs. You may have heard other people talk about
with veneers, okay,
how cosmetic dentists will just make stubs out of your teeth and then put veneers on them. And that's an easy way to do it, but it's not the right way to do it.
So it's not the way you do it?
No. You want to preserve as much of your natural tooth as possible and add to the tooth instead of taking away from it.
Interesting.
And that makes them last much,
much longer. So is that a philosophical change, difference that you have?
I think it's an ethical choice
right.
for a dentist to make that. And if it's done, it's responsible because it's giving a person a smile that they like now and ensuring that they're going to be able to have a good one for the rest of their life.
Okay, great. Now you have more photos, and we're short on time. So what are we looking at?
Yeah. So actually, this last patient's father saw the change that it made in his life. So he wanted to come in and have something done with his teeth. Look at his before photo, and he was so uncomfortable when I was taking the picture because he just couldn't smile. He didn't want to smile.
So that's his smile?
That was the best smile that I could get out of him. And he was very embarrassed by it. And with him, he just had one tooth in the very front that had a chip in it that was broken in half. And I added material to make that so it was invisible, so it looked like he'd never broken it before. And it made just a huge difference in how he felt about himself.
So before he's walking around in Utah with that...
hiding his teeth, hiding his smile.
Very interesting. I mean, it does make a big difference in the appearance.
And I'm very glad that his son was able to help him to come in because a lot of people are embarrassed by it and they don't know how easy it is and how quick
Now, in Utah in particular, and we've had this discussion, a lot of people, they have a general dentist, family dentist, they've known their whole lives, and they're afraid to switch over to maybe you as a cosmetic dentist. But as you pointed out, they don't leave that dentist.
Yeah.
What do you mean by that?
So when you're looking for cosmetic dentistry, you want to go to somebody who's just truly focused on that. And you don't have to change all of your dental care for the future.
So they could get veneers through you,
yeah,
and go and do everything else with their...
Yeah, and keep that loyalty to the dentist that they have a good relationship with, and but at the same time get results that are going to look world class and last them for their lifetime.
Do you get that, by the way, where people will come in and say, you know, I already have my dentist, I don't want him to even know I'm here?
There is a lot of loyalty to a dentist. It's somebody you have to really trust, and I by no means want to ruin that relationship that patients have with their dentists.
Okay.
But at the same time, I'd like to offer them the world-class cosmetic dentistry that's available.
Okay, good. So what else do you have?
This was actually a friend of mine, and he's an athlete, a triathlete, and he bumped his front tooth and it went dark. And he had just assumed that he had to go his entire life with that dark tooth. And I had to bring it up to him and mention to him that we could actually make that look like it used to look before by putting a crown on that tooth. So we just put a crown on that tooth and it made it blend in better. And if you look before, when someone has something wrong with their tooth, it kind of brings some connotations. It makes you think things about them. Maybe they're not so smart or not so successful. And that's not the case for this person. So to be able to bring it back to how he looked before was
it's amazing how
huge
just
change.
one tooth does make a big difference.
Yeah. You take any successful person out there with a great smile and you take one of their teeth away and it's going to make a huge change.
Yeah, yeah.
Here's another picture of a young lady who, if you looked at her, she had a good smile before, but she wanted to make a change in her life. She didn't like how her side teeth looked small and there was a little bit of spacing. So she asked if we could make them more full looking and to fill in her smile.
So when you look at this woman on the before, because she's already pretty, great smile it seems like, what's going on in your head? Like what are you thinking needs to be done?
Well, we look so closely at the details that I can see, even though she has a good smile, I can relate with how she's feeling about her teeth. I can relate how maybe the average person wouldn't think there's anything wrong, but I can see that it would make a huge difference. And then if you look at the after picture, you can see that it does make a big difference.
Yeah.
It fills in her smile.
Looks like a cover model of some sort.
She wanted to do modeling is actually what happened. And this is what helped her give her the confidence that she could do that.
Now we are short on time, but you believe if you change your smile, you could change your life. You could even win friends with a better smile.
Yeah, I remember when I was talking with you earlier about that book you had just read and how in our economy nowadays that a smile is the new currency is what you described.
Yeah.
And I think that has a huge, or I think that there's a lot of truth to that.
You know, trust. Yeah, I mean, it seems like that people that are smiling seem more trustworthy.
Yeah.
And we talked about the presidents.
Yeah.
It seems like the presidents with the best smiles
are the ones that win. It's it's the person who has the best smile that attracts other people. It's the essence of charisma in my mind.
So if you don't like your smile, and we're out of time, somebody watching this, right? They don't like their smile for whatever reason. What do you say to them?
Then they should definitely have a consultation where that they can have this 3D simulation to see what it would look like, the smile simulation, to see what the change would look like.
So when they go to you, it's a free consultation, and you show them with pretty good accuracy what it's going to look like?
Very good accuracy based on the position and shape of their own teeth.
Now, we are short of time, but you brought a video of something you actually show patients of how a smile can really change your appearance. So what are we looking at here?
So you're looking at the video on the left of him with his regular teeth, and he's just talking. We have the sound muted out. And then on the right, it's talking with the simulation of what his teeth will look like after we do the work, when we just put in that temporary for him to
So those are just
look
like,
and feel.
They're not snap in, they're just kind of made right there in your office?
Yeah, they're made
For
off
the consultation?
they're made off of the diagram of his teeth to fit his face and his lips. Look at the difference in the before and afters. Look how he feels different. Look how he looks
He
different.
does. He looks like,
Yeah.
I mean, it's different to watch this guy with just better teeth. You know, as I said, it's just teeth. But here is an example of how much better it can be.
Yeah.
Now you have a little diagram. You say there's so much that goes into the design of a smile. So when I'm looking at this slide with all these numbers, what is that?
Yeah, I mean, those are the millimeter changes. So we know if we need to lengthen or shorten or widen based on ideal proportions so that things look harmonic.
So it's customized.
Depending on how tall or short the teeth should look, depending on the shapes and the personality like we talked about before, the different shades of white and brightness, wanting to make things look real and natural. There's a lot of art to it. I love it.
Now you were in the military. You were a military dentist. Is that right?
That's right.
And then you said you heard about this American Academy of Cosmetic Dentistry.
Yeah, I was.
And you were like excited. So you told me.
I had been in Afghanistan and I had really come to enjoy getting people out of dental pain. Obviously, you can imagine that I was helping a lot of people get out of infections and broken teeth, and I was trying to figure out what I would do next and came across this brochure, this pamphlet that showed these before and after photos of dentists who had worked on this credentialing through the American Academy of Cosmetic Dentistry. And I knew that was the kind of dentistry that I wanted to be able to offer my patients. I wanted to be ready when people wanted to improve their smile, to be able to make them look that good.
So in Utah, you say that there's very few, if any, of these people that have that are part of this AACD, this cosmetic training. Is that right?
That's right.
You've developed a group.
Yeah, I started the Utah Academy of Cosmetic Dentistry to help other dentists to be able to achieve this. I think it's sad that no dentists here have done that yet.
When you say sad, are you frustrated that the public doesn't know the difference?
I am frustrated because as a dentist myself, being able to recognize the details, I'm able to see how much of a difference it does make in the quality of the looks of the case now and far into the future.
So when I feel like I could spot veneers, that's a bad job.
Absolutely.
Is that right?
Yeah.
That's how you feel about it?
Yeah, your teeth should look good, but they shouldn't look fake.
Okay, good. I want to thank you for coming on the show. Very interesting.
Thank you, Randy.
Good job. You've been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.